All right, good evening, everyone, and thank you for joining us for tonight's mental health series, part two, exploring mental health conditions. Again, we appreciate you all being here with us. So, really quickly, I'm going to do a welcome introduction of speakers. Our workshop presentation will take place. Then we'll have Q&A, a live raffle, and then the surveys in closing. So again, throughout this recording, please keep your mics on mute. And if you have any questions, please use the chat. We will have time after the presentations to take yourselves off of mute if you want to ask questions then. But if you have something that you want to ask during the actual presentation, please put it in the chat. And also look out for the survey. We're going to drop the survey link into the chat. So just kind of be on the lookout for that. So meet the team. This is my team. We have our manager, Walida, my teammate, Sue, and my other teammate, Afia. Follow us on social media at UCM Urban Health Initiative. We are on Facebook, Instagram, and also we have a YouTube page. So follow us to keep up to date on upcoming events, a lot of health resources, things that are going on within the community. So just follow us. We have some really good information to share with you guys on these sites. Upcoming events. We will be hosting a Women and Girls Health event, which will be in person. Location is still to be determined, but again, it will be in person. Will be our third one. So it's a really great event for our women and girls to come out to get some great information. And then we'll also be hosting our high school healthcare career event, which will take place in April. And it's also an excellent event for our high schoolers to come out and talk with healthcare professionals about various careers in healthcare. And it's again April. It's in April. So again, this is something that will be in a follow-up email. I'll let you know about all of the upcoming dates for these events. So again, we're Urban Health Initiative, UChicago Medicine's Community Health Division, responsible for collaborating with community-based organizations on health-related programs, research, and services for residents on the south side of Chicago. Some of the things that we offer are health and wellness programs, high school healthcare career fairs, sponsorship events, community health focus hour, community newsletter, fitness classes, and volunteer engagement. So let's meet our speakers. So we have Aditoriola Tori Odatunde, and Dr. Odatunde is an emergency medicine resident at UChicago Medicine. She is passionate about incorporating her knowledge of social epidemiology into clinical practice. Dr. Odatunde was born in Nigeria and grew up outside Toronto, Canada. Welcome, Dr. Odatunde. Next, we have Ekiomoda Eki Olamis, and Dr. Olamis is an emergency medicine resident at Chicago Medicine also. She is interested in building infrastructure for emergency training as well as enhancing health literacy for the community. Dr. Olamis plans to work with community partners on the south side of Chicago on diabetes and heart health education. Welcome, Dr. Olamis. And we have Karina Alexander, who's a peer supporter for Sister Apia Community Care, not-for-profit. Ms. Karina Alexander is a passionate advocate for holistic wellness with a strong belief in the transformative power of movement for healing. Through her work, Karina inspires others to embrace a pathway to overall health and vitality, fostering a community dedicated to living fully and authentically. Thank you so much for being here, Ms. Alexander. And now I am going to stop my share so that we can get started with our doctor's presentation. Go ahead and take it away.
Awesome. I'll go ahead and share my screen. All righty. Welcome, everybody. It's great to be here. Dr. Olamesha and myself, we're very excited to kind of be able to talk to you guys about, what's going on and how to help you and your family kind of be able to recognize some things as they pertain to mental health, and how to seek help, when you need it. All right. So some of the objectives of our presentation: we want to be able to understand the definition of mental health, and more importantly, why it's important to actually discuss this, sorry, in our communities. We're going to go over some common mental health conditions as a general overview and some of their signs and symptoms. And then lastly, we want to be able to provide you guys with the resources for accessible mental health resources here in Chicago that you're able to get a hold of. So we're hoping that this presentation helps with that. So as a little forward for disclosures, Dr. Olamesha and myself, we have no financial disclosures. We have no financial ties to any of these topics. And we want to put the disclaimer that we are emergency medicine doctors. We are not psychiatrists. However, based on, the scope of our practice, we do see a lot of individuals who present with mental health conditions. And because of our job, we actually see individuals who present in what we call a decompensated state. And that's another way of saying we see them at their worst. However, a lot of mental health conditions don't necessarily present like that, and they're not always obvious. So we want you to keep that in mind that, a lot of the times when we see some of these conditions, it truly is at the point that it's gone beyond the recognizable stage in the early stages. And, it's when people are really, needing acute help. And from our presentation, we want to ensure that you don't try and diagnose yourself from, our friends or family. We want to leave that to the professionals, the behavioral health specialists, the psychiatrists. We just want you to be able to recognize some of these symptoms and be able to act on them when you can. So just wanted to put that out there as we get into the presentation. So what is mental health? The World Health Organization defined this in 2022 formally. It is a state of well-being that enables individuals to cope with their stressors of their life, realize their abilities, learn, and work well and contribute to their community. So mental health is bigger than, just kind of you as an individual. It's truly how you interact with the world around you. So why is it important? Because mental health affects your quality of life. If your mental health is not okay in the same way your physical health is not okay, it can impact the quality of life. And it's important to know that in your mental health, it's not something that's like one controllable thing. There are a lot of different factors that feed into your mental health. There's biological factors, being female is one of them. Your age, understanding the disease processes, whether you have chronic conditions or acute conditions, brain chemistry, that can definitely influence your mental health. There's also the psychological aspect of things, your beliefs, your personalities, kind of the psychological environment that you grew up on, and like how, what are your pillars of life, your self-esteem, your learning and memory. Those are things that can also contribute. And also the social aspect of things, right? Your education has an impact as well, social support, socioeconomic status, as we talk about, and then cultural influences. And as you can see, there's a lot of overlapping with all of these, but all of these can feed into your mental health. So it's not one thing that's controlling your mental health. There's a lot of things that are, quote unquote, controllable, and some that are not, that will feed into your mental health and kind of affect, what that looks like as well.
Hey everyone, I'm Dr. Olumase. So I'll be taking over this next part of the presentation, and we will be going into common mental health conditions. And this is really an overview to look at some of the signs and symptoms that you might see of various conditions. Next slide. So two of the most common classes of mental health issues are anxiety and mood disorders. So I'll start with anxiety. So it's a group of conditions that you could think of as related to being worried, fearful, or nervous. And I do want to emphasize that a lot of us experience anxiety in our daily lives, daily activities. It becomes a disorder to address when it starts to affect your ability to do your typical activities, such as working, going to school, taking care of your family, things like that. And some various examples are there at the bottom. Generalized anxiety disorder, which is where you may have anxiety about a lot of different aspects of your life. Panic disorder, which sometimes manifests as having like a panic attack where you might have like a sudden onset, like worrisome fear, and then social anxiety disorder where you generally have worry or fear in social situations. Mood disorders are a group of conditions that really are looking at persistent changes in mood. And again, the disorder comes into play when it starts to affect your ability to do your daily activities. Major depressive disorder, I think, is a common one that a lot of people hear about, and signs and symptoms of that can manifest as simple as like difficulty concentrating and reading a book to starting to feel like you're losing your appetite, to feeling like you're having trouble sleeping. And when this is persistent over multiple weeks, it's when you start to think about it being a disorder. Bipolar disorder is typically thought of as, or the definition of it is like having what they call like manic episodes, which can present in ways where you might feel like you don't want to sleep or need to sleep. You may have ideas of like what they call grandiosity, which basically looks like, oh, I feel like I can rule the world. I have millions of dollars. I can do all these things that are not necessarily truly things that you are capable of doing. Seasonal affective disorder, I think, is also something that's popular in the media where it may be certain times of the year, like when it's darker outside, colder outside, like in winter, where people may feel sadder and kind of manifest symptoms that are similar to major depressive disorder. Next slide. And then the rarer conditions, psychotic disorders, these are thought of as having a loss of reality. So these might manifest with hallucinations, which it might be like hearing voices or seeing people or shadows or things that other people can't see. Having delusions, for example, thinking that like Bill Clinton is your best friend or something like that, something that is like not necessarily something that's true, or having just disorganized thought processes. And schizophrenia is a type of disorder that falls into that, as well as delusional disorder. And so we also just want to emphasize that kind of like I mentioned with the conditions, there's a lot of different signs and symptoms of all of these different conditions. And I think the key is recognizing when you feel like your mood is affecting your ability to do the things that bring you joy, or you're just not finding joy in the activities that you used to. And if you do need help, there's a lot of different options for you. I always like to tell people that the best time to go to therapy is when things are going well, so that you have somebody to turn to when you're going through a crisis situation. So I always highly recommend therapy and support groups to patients. Um, Also, you can seek care directly with other mental health professionals. Psychiatrists are professionals that can prescribe you medications, which I like to think of mental health as um, any type of issue like diabetes. Sometimes people need medicines to help with their sugars. Sometimes people need medicines to help with their mood. And I hope that we continue to push that kind of thought process around mental health disorders forward. And then you can always call for help if you're ever in a crisis situation where you feel like you are a danger to yourself, or somebody else you know is at a danger to themselves, or poses a danger to somebody else. You can always call 988, which is the suicide and crisis hotline, or 911 if it's an emergency. And feel free to screenshot this. This is a list of various lines that you can call for mental health support, from the domestic violence hotline to specifically a maternal mental health hotline. We also have a trans hotline, but you all can take a look and take a picture of that. And so this is a list of some free mental health resources in Chicago where you can physically walk into and see someone, which I feel like in this world post-COVID, a lot of therapy resources have gone virtual, but if you're interested in going to something in person, these are some options. Thanks, y'all. I'm happy to take any questions.
Thank you so much for that presentation. If anybody has any questions that you want to ask right now, or if you want to hold off until later, that's just fine as well. But great presentation. Um, yeah, so we will keep it moving. We're going to go ahead and turn it over to Corey Alexander, who's going to speak about Sister Althea Community Care Center. So take it away, Corey.
Hello, everyone. My name is Corey, and like the beautiful Aisha said, I am a peer supporter with Sister Afia Community Care, and we are here to make sure that Black women have access to the support, resources, and care that we all deserve. Our mission is to build sustainable mental wellness communities by providing affordable, culturally centered care that meets the unique needs of Black women and girls. So, we are a nonprofit organization and we are committed to making mental wellness accessible to our community. So, we offer a couple programs, and through our programs, we have free and low cost therapy, community workshops, and professional training in order to uplift one another so we can all thrive together. And we also understand that challenges arise, and especially in the community of Black women seeking care. And every day we're working to remove those barriers to make it easier to get the mental health care that we need. And then I am a peer supporter with one of our new initiatives. It's called Heal Together, and it is a free community based mental wellness program designed by Black women for Black women in Chicago. And we adapted this initiative from a global model that has successfully supported women in their mental health journeys. So now we've taken that model, we've revamped it, and we offer free 30-minute virtual sessions with myself and our other lovely peer supporter named Danielle, where you can receive compassionate listening, emotional support, problem solving strategies, and connections to other mental health resources. And so it's really a 30-minute talk session that's all about you. Whatever you want to talk about, if you want to vent, if you just need somebody to listen, we offer that unbiased, non judgmental ear and a shoulder to lean on. And this program was specifically created to ensure that no sister has to struggle alone, whether you're facing stress, life transitions, or again, just needing somebody to talk to. We're here to support you. And you can also follow us on Instagram at Sister Afia if you wanted to check out any of our free workshops, wellness events, or training programs. You can go to communitycare.sisterafia.com. And that's all I got. If anybody has any questions, you can feel free to drop them in the chat.
All right. Thank you so much for that information, Corey. And I will definitely share the link for Sister Apia that Corey mentioned. I'll share that in the follow-up just in case you all want to, check it out. I think it's an amazing, amazing organization. So definitely, if you don't use it, pass it on to someone who can use it. So right now, I am going to open it up to questions for our wonderful presenters. So if anyone has any questions, and also for the resources that our Dr. Olamise had in her presentation, I also share those as well. So if you didn't get a chance to screenshot them, no worries, I got you. So let's just check and see if we have any questions. So we're passing it along to my niece. Okay. Oh, okay. So somebody's going to be passing it along. Okay. Thank you so much for doing that. So we have a hand from Ray McCray. Did you want
Yes.
to go ahead?
Oh,
Thank you for being
yeah.
here, Ray.
Oh, I thank you, wonderful people, for having this, trying to get this together. Okay. This is my question. When you talked about the psychotic disorders, I took care of my mom who had dementia and she had those very, very symptoms. Is that just part of the disease?
Yeah, thank you for that question. Yeah, there's also various different neurologic diseases that can present with psychosis or with like various like hallucinations or like loss of reality. It's not just something that's under the psych umbrella, but you may also have like various forms of dementia or some kind of neurologic disease, some kind of disease that affects the brain, that can cause that presentation.
Thank you.
Hmm.
Thank you for that. Really quickly, Corey, what is the ages for the women who can attend your sessions?
Hey, so as of now, they start at age 18 and up.
All righty, thank you.
Mhm.
All right, audience, any additional questions? Well, we got this great panel here that's available to take all your questions. So we got something. But if not, I do have a couple that were submitted. So I'm going to go ahead and I'm going to get started. So this will give you guys a chance to kind of like, come up.
I think Regina unmuted herself. I think she may
Oh,
have to ask a question.
I did have a question. What are the requirements for Mrs. Corey and the program?
Hey, so the requirements are that you are a Black woman and that you stay in Chicago or any of the surrounding suburbs.
that's great. Okay. All righty. So one of the questions that was submitted is how can mental health support be better integrated into everyday settings to ensure early intervention? So again, how can mental health support be better integrated into everyday settings to ensure early intervention?
I think that's great. And I think, that question was asked with a purpose because I think someone has assessed the need for that. I think a lot of it is conversations. It's being, educated in spaces like this. It's saying that I want to be able to talk about this. I think a lot of the times in our communities and Black communities, these conversations have felt very taboo in the past.
Mhm.
And because we've kind of, hid away from them, we're not really, informed of the, kind of the presentations of these diseases. So I think the first thing starts with a conversation and then taking it upon yourself to be educated and share what you know. Again, too, as we said, we are giving you the generals. We're not asking you to go out and diagnose individuals in your community, but understand the general principles, the general symptoms, things that you can recognize and share those with people. It's the same way, in the work that we do, we want people to go out in the world and be able to recognize a stroke and what that looks like, right? A lot of that is based on education, so you can help someone. I don't think that mental health is any different. So a lot of it is being willing to have those conversations and to be able to have, resources that you can give to individuals like the phone numbers that we shared, when needed and to share that around. We just need to keep talking about it. As we keep talking about it, I think we can definitely kind of make an impact and allow it to be something that's, I guess, better well integrated.
One more question. In this climate, in a predominantly non-African American work setting, how do you best advise the only one out of three African Americans to adapt in those type of environments?
I think that's so tough. I think that definitely it brings up a lot of emotions to me with the type of climate we're living in now, where DEI is becoming a term that we can't use if we want to get funding for things. Um, I think, like just speaking from the perspective of somebody who has gone to PWIs, predominantly white institutions, my whole life, um, I think it's important for us to like recognize within ourselves how we're feeling, and to validate our own emotions, first. And I think it's also very important, to try to find ways to keep ourselves well in those environments. And I think that it can be done in various ways. Hopefully, you have colleagues who are supportive of you and your work and, can help with uplifting you, but also, um, trying not to be, afraid of advocating for yourself when you need to in particular environments.
Um,
Thank you.
And to go off of Dr. Olamese, also setting boundaries. I think we don't always have to engage in politics at work, especially when you know people don't have the same views or you know those conversations are going to be draining. You can step away, you can walk away. You might be passionate about it, you might be well versed on a topic, but again, having those boundaries, like Dr. Olamese said, knowing within yourself kind of, what's going on.
And I would also like to add to that, finding community like outside of work. And so having a strengthened community, you can have those conversations outside of work. And like it was just mentioned, having those boundaries, not to submit to conversations that you feel uncomfortable with or that may make you feel uncomfortable. And just working on like self-care, saying no is self-care sometimes. Setting boundary is self-care, but also like the more that we give into the self-care and like loving on ourselves, we become more confident. And so being confident in advocating for yourself, being confident in saying no.
Wow, so much for that. We just recently did a workshop on mental health and self-care. So just and we had a presenter on who did breathing breath work. So just knowing how to breathe it out, that's so important, something that we take for granted, but just, knowing the proper way to breathe when you're in an extremely stressful situation, how to, bring yourself down, and even some stretches she incorporated. So, it's great to, like you said, have that self-care avenue so that, because it's a lot going on. It could be a world in the world or just basically at home. It's stressors everywhere. So just knowing how to center yourself and take care of yourself is just a part of mental health, taking care of yourself. So thank you all for those answers. Another question is, what is the best way to help someone who is experiencing an episode in a community gathering? And that's kind of tough.
I can try to tackle this first. I think, I don't know if you have like a specific scenario, or whoever asked the question, I don't know if they had a specific scenario in mind. I think it depends on the scenario and it depends on the scale of the gathering. I think that if it's a scenario, where you might have somebody who is like maybe having a panic attack in like a large crowd or something like that, I think removing the stimulus, so like removing them from like the large crowd might be helpful, for example. If you have somebody who is like becoming like more aggressive
Maybe.
or hallucinating or something like that, that's somebody else who can also be taken away from the scenario. Sorry, you had something to add?
Yeah, this is Ray McCray again. I asked that question,
Oh, okay.
Okay.
and the scenario is in church.
Okay.
Uh, that's the scenario, and the young person became highly agitated, and four or five people rushed up on her, and then she became violent. And my question, then we had people in the church talking about rebuking a demon, which I know is just ridiculous. But that how can someone actually be effective in a situation like that where they don't, exacerbate the situation?
Yeah, I mean, I think it's tough. So I think about how when we have people who may become aggressive in the emergency room, for example, we really try to see if we can verbally de-escalate them. So if you're in a church scenario, hopefully there's people that that person knows around them, and maybe they can help to verbally say like, you're in a safe place. Like, what are you going through right now? Let's step outside. Let's talk about it. Something like that. And if that doesn't work, I mean, you may potentially have to call the paramedics, if you need help in that scenario, and potentially bring them to the hospital if you're concerned about some sort of mental health condition.
Okay, thank you.
I also saw this comment in the chat about people self-medicating with marijuana. So I will say that you kind of never know what you're going to get these days. We actually had a couple patients, without breaking HIPAA, we had a couple patients the other day who presented to the emergency room around the same time, who both said that they smoked weed and they had a really, really bad reaction to it. And it was a very similar reaction. And we don't know exactly what was mixed in the marijuana, but they had like really strange, like twisting movements of their face, which is not something that we normally see after people smoke marijuana. So even when people go to the dispensary and buy the weed from a reputable source, you don't always know what you're getting. So I will say be wary of that. And like outside of marijuana, when we see drug use of other sorts, a lot of times there's so many different things mixed in the drug that people do not know what they're getting and can unfortunately get a really dangerous dose of a drug if they don't know what they're getting. I don't know if
True.
that's what you were getting at with that question, but that just came to my mind because I just saw that.
And I think also too, you kind of noticed the self-medicating aspect of that in the question that, I think that's a band-aid for kind of a bigger wound. And I think at the end of the day, you need help. Whoever it is needs help, to be kind of figure out what's going on and how that can be treated directly. Does it need, therapy? Does it need medications that are, monitored by a doctor? Those are the kind of things, but I think, it's very easy in the moment to have a short-term solution to something for some individuals, but, no, marijuana is not benign. And I think, through research, we're finding out the long-term effects and what that can do to the brain and such. So not just for marijuana, but any drug, to self-medicate is not addressing the underlying solution. So the underlying problem, sorry. So we urge people to kind of make sure that they figure out exactly what that is and then get treated appropriately.
Okay. So my question is for Corey. So do you all have, when you all have your sessions with your clients, um, is there someone who, like, if you all feel that they are in need of medication, is that a next step, or do you guys refer them out somewhere else, or how does that part work? Because I know that you're in the holistic wellness space, so how would
Yeah,
you?
so through our peer support program, we are not licensed therapists and we don't do any prescriptions. And so, how that works is if somebody is seeking therapy or if we are concerned about a person and we think that they need to seek a psychiatrist or anything like that, we do have our like internal levels, and like that would probably go to Kamisha or our executive director in order to get some help for them. But a lot of people who I have seen are in like a transition, like they have done therapy and now they're out, or maybe there was like something with their insurance for a little minute, or just people who have never gone to therapy at all. And so, what we can do is talk about it. A lot of people have questions like, what is therapy like? And it's like, I've been to therapy. I can talk about my experience and like, some different experiences, but I can also provide resources and just asking different questions like, do you prefer a Black woman? Do you prefer a male? Do you prefer to be in your neighborhood? Do you prefer to be outside? And so through Heal Together, it's more of a individual approach. So depending on the person and their needs, I can provide different resources.
Okay, thank you so much. Okay, we got another question. Corey, do you partner with mentors for young men?
So specifically through Sister Afia, we do not, but I have like through individual client research found a couple. So I could definitely provide those.
Okay, thank you so much. Thank you for the questions. Keep them coming. If anybody else has any questions, feel free to unmute yourselves or put them in the chat. But again, I'm just appreciative for my panel for providing this amazing information. And again, we thank everybody who's on the call. Definitely, appreciate it, and we're glad that you guys are here. And we're hoping that you all are, finding this to be very important, important information and resources that are being shared. So, okay, if there are no other questions, I don't want to
Yeah,
keep.
I'm sorry. I got one more if you
No,
don't.
don't be sorry. This is the time to ask.
Okay. I'm going to ask it the best way I can. How do you handle a situation when a person who knows they're dealing with mental illness fixates on you as if you are the one that has to be supportive with them in whatever they do? And then when you're not, they just turn against you and you are the problem. What, how do you deal with that?
I think that's a difficult situation because I think there's a lot of emotions at play. I think both ways. I think an individual who knows that, they need help outside of themselves and are looking to one individual, but, you know, that individual in your life is not going to solve all your problems. And I think that's a lot to put on somebody. So if you are on the receiving end of that, I feel for you and also want to encourage you to set your boundaries. Again, easier said than done because I can imagine what it's like to need to feel the need to show up for someone in that moment. But I think sometimes like it's just about listening. I think that that's very helpful to be able to listen in a space like that. But to really set your boundaries as well. Just say like, hey, I can't do X, Y, and Z for you. This is what I can do for you. This is how I can show up for you. And then filling in those gaps, being like, I can't do this, but I recommend you do X, or going with them to do this, or providing them with resources, not just a full stop, I can't do that for you, but solutions to that problem. And I think overall, that's showing that you are showing up for that person and you are caring. And hopefully, they're able to do that. And I will say the caveat is, I think with a lot of mental disorders, those connections might not be made in the moment, and that might just be kind of truly due to, the mechanisms at work in their brain, in terms of brain chemistry. So don't take it personally, and kind of just again do anything that you can to establish the boundaries and help them in any way that you can, but not without overextending because you can't pour from an empty cup. And I want you to be able to remember that as well. So don't carry that, on your back. Do what you can, what's best for that individual, but also again provide them with the resources that you need. And again, you've come here today, you have a whole list of resources that you can give. So I think you're already doing the work, which is great.
Thank you, doctor.
Thank you for that. We have a couple more questions. How can parents identify early signs of mental health struggles in children and adolescents?
I can try to tackle that one. I think it can manifest in a lot of different ways as children, in children. For one, children who are maybe having trouble concentrating in school or having trouble concentrating at home, could be a sign of maybe they're not able to pay attention. Maybe they need to be evaluated for ADHD, for example. I think another thing, the children who are, quote, labeled as like not listening or disruptive, or for whatever reason are not able to get along as well with other children who may have some issues with like social interactions. It could be another sign of a potential mental health struggle. And going off of that, I think that like something that I think is really important is educating children from a young age about mental health and resilience techniques. It's something that I don't think I got enough of growing up in school, and I think something that happens more now in school, but I think a lot of times kids don't have the verbiage to describe what's going on. And it's really important for us to teach children and say, like, hey, just because just because you're struggling to concentrate in school, it doesn't mean there's something wrong with you. It just means, oh, maybe we should investigate this and look into how we can best help you.
Thank you. Where do you see mental health treatment access to treat going over the next couple of years?
We hope
Where
growing, honestly. I think we're kind of on the right path, and having conversations like this are going to do that. I think also there's, a booming population of individuals who are getting involved in the mental health space, and showing up. And whether, you're like organizations like Corey's, which are wonderful tools and liaisons as well, to a lot more, I would say even Black doctors, showing up in those spaces as well. We're hoping that it can become accessible. I think, if you said 20 years ago therapy, it would have been, somebody who was pictured to be wealthy and had time to pay someone to listen to them. But I think we're understanding that it's a resource the same way. Like, healthcare is a necessity, and I think that extends to mental health. And I think we're finding that now. It's not a privilege, it's a right. And I think as we continue to have that mindset, I hope that it is going to be accessible for individuals in years to come, to the point that, you don't have to, it's all there at your fingertips, the same way going to the ER, is right there for you as well. We hope that the mental health resources as well. So continue to advocate in your communities for things like this, for, opportunities to talk about things like this, and support, any organizations you can, because they're doing a lot of work, behind these things to make these things accessible for individuals as well.
well said.
Another question. Are there resources to help children who have become addicted to the screens?
Good question. So stay tuned. We often have a workshop that focuses on our children and social media, the aspects of it, and how to, ways to monitor, ways to cut back, So we did have that workshop last year. We have it once a year. So I will definitely, again, well, you know what? Once you sign up to receive our newsletter and updates, you can keep up with our upcoming events. But that will be another one that we will be hosting again this year. So
Thank you.
you're so welcome. And I think Corey had something that she was about to say.
Yeah, I was agreeing with the doctor before. Great advice, and I was seconding that.
Oh, okay, gotcha. So I have another question. It says, how do I support someone who has mental health issues and we share children? The person is verbally abusive and has rage episodes.
Again, another difficult situation, and sorry for whoever's going through that. I first and foremost want to say you need to protect yourself and your children, and whatever that looks like. Again, easier said than done, but anything that you need to do to be able to protect your family in that moment. um, have conversations with this individual as much as you can, see what they know, see if they're willing to seek help. And again, providing them with those resources is super important. But if it gets to a point where, we call it decompensated, that's meaning it's at their worst, they're not able to function, they're a hazard to themselves or others, that's when we need you to kind of, maybe call 911 and take them to the hospital or a crisis line or something like that, to be able to do that. But I acknowledge that's difficult, because it's one thing to have a personal relationship with someone and then to share children and then to try and navigate that space, because you're also trying to, talk to your children. And I think talking to your children as much as you can. I think, there's a generation of kids who their parents weren't really telling them what was going on. And so they kind of had an idea, but they weren't being spoken to. If your children are of age to have certain conversations and kind of just, examples saying, your parent is not doing well and maybe not getting into specifics, anything you can do. To be able to inform them so they're not kind of in the dark. Because again, as we talked about all the things that feed into mental health, bearing witness to those things, as a child of not having answers, not having an understanding what's going on, that could impact their mental health moving forward. So I think it's important that you protect that for them and for yourself. So I would say those are my recommendations.
And does UC offer a crisis line? Mm,
I don't think so. I would go for the 988 number that will route you to a crisis worker or 911.
All right, these are great, great questions. Thank you all so much. Any additional questions, audience? Again, thank you all for participating. I'm checking through to make sure I did not miss anyone's question. Not. So again, this has been an exceptional discussion. I appreciate all of my panelists. You guys were really great. If you all have any closing words that you'd like to give before we go, and also before we go, we're going to do our raffle. So participants, don't leave yet. We're going to do a live raffle to see who's going to win a nice gift. So, but before we do that, we'll have our panelists to close out.
I just want to thank everyone for showing up because it shows that you care and it shows that you kind of want to move the needle in a positive direction as it pertains to mental health. You want to be informed and, you're already off to a great start. And those who, you get to interact with in your lives are very blessed to be able to have someone like you who's willing to help and be informed and to do what you can from your position.
What was that? What was that? What do you mean? Oh, what's that? What did you just do?
Okay, we need you back on mute, sir. Okay. Okay, go ahead. Did you all have anything else?
I just wanted to say thank you, everyone, for showing up for us, showing up for yourselves and your community. A big kudos to everybody just for popping in. Thank you to everyone who asked questions and just providing a state of vulnerability with us and trusting us with this information. I would love to see you all in individual sessions and even group and workshops. So thank you. And thanks for having me.
Yeah, thank you everyone for coming and for all of your questions. I think it definitely brought out an important discussion. And I would just like to emphasize, I think the best tool is education, and understanding what mental health is, why it's important, and that it's like there's never too early of a time to seek help. There's never too late of a time to seek help. Whenever you're recognizing that there's something going wrong, there's many resources in Chicago that are free that you can seek help.
You ladies, I again just a big kudos to you all. You all are phenomenal. You all provided some amazing information. I'm so appreciative to have you all on this panel this evening. Look forward to working with you all again. And again, to my participants, you know, events like this are, we do it, as Dr. Olamuse said, education is so important. So we offer these as a way to educate you all, and it's for free. And you get to talk with these wonderful professionals, for free, and get their input and information and resources. So we do this, we're going to continue to do this. And the reason why is, again, education is so important, and this is part 2 of our mental health series. We do this every year because, again, who doesn't need to know more about mental health and ways to take care of our mental health? Mental health is self-care, it's health, it's what we need to take care of to be sustainable, to be, to live right. I'm losing my words, but again, mental health is it's so important. And again, with the climate that we're in, it's just a lot that's happening, and we need to take care of it. And we need to, it shouldn't be a taboo topic as to, oh, we can't talk about it. I know it used to be as such, but I feel that we have grown so much in this space to where the point of I have younger relatives who are in grammar school who talk about, we've talked about it amongst ourselves, and they are grasping the fact that mental health is important. They need to take care of themselves, and that's important because little, children deal with a lot of stuff too. So they need to know how to navigate through these challenges, so again, appreciate that. I do have a question. And for Rashana, as far as the newsletter, I will definitely send you the link when I send the follow-up email. I always send a follow-up email to everyone who participated in the workshop, and it includes the resources that were provided throughout the workshop, as well as, how to sign up for our newsletter, et cetera. So we have a question. Daud, you want to go ahead? Hello, Daud, you want to ask your question? I see that your hand is raised, or maybe that was a mistake. Okay, so I am going to pull up the screen really quickly. We're going to do our live raffle in just 1 second, and the survey has been put in the chat. But even if you can't get to it now, I will also send that out in the follow-up email. So no worries, you don't have to try to scramble to do it right now because you will have a chance to get to it. So let me just pull back up my screen. Okay, so again, the raffle that'll be sent to you with the follow-up email. And again, it's our upcoming events that'll be within the next couple of months. You'll find out more about the dates and locations of these events. Please come out. Again, these are free as well. So now we're going to do our raffle. And again, just follow us on social media, on Facebook, Instagram, and we have a YouTube page where we host our free workout sessions, our workshops, a whole bunch of helpful resources. So follow us, keep up with us. And this is information to contact us if you ever would like to have us come out to present. So we are open to doing that. Again, this will also be shared in the follow-up email, so no need to try to get this down. And again, thank you. I just want to say again, thank you. So Sue, if you're ready to pull up the wheel so that we can spin this wheel and get us a winner.
Okay.
So much. So we have everyone's name on here. Right, we have Miss Ray who has won. Ray, are you still on the call? Uh-oh. Ray, are you
Yes, I
here?
am. I was
Oh,
on mute.
okay, you had us worried there for a
Woo,
minute.
woo, woo. No, I didn't leave. Oh my goodness, I'm so
Wonderful.
excited.
Yes, as you should be. So yes, thank you. So I'll be in contact with you to get you your gift. And again, I just want to thank everybody for being here. We look forward to seeing you in upcoming events, virtual and in person. And thank you all so much. Appreciate you. Have a great evening.
Thank you.
All right.
You
All right.
too. Thank you so much.
All right. Thank you. And thank you, panelists. You all were amazing. Thank you. Take care.